Glaucoma is a condition in which the pressure inside the eye exceeds the pressure that the optic nerve can tolerate, and therefore damage is occurring to the optic nerve. Over time, as that damage progresses, eventually it will start to cause a person to lose a portion of their visual field. And many times at this point, it's asymptomatic and a patient has no idea this is happening. And if it advances far enough, then one day they will trip over a chair or get in an accident and be asking themselves why they didn't see it, and come to see us and find out that they're missing a significant portion of their vision. Obviously, the goal is for us to detect it prior to any of that, and then the goal of treatment of glaucoma is to hopefully lower the pressure to a point at which that process stops. And we can accomplish that with drops, which has historically been the primary way that that's treated. We also have a laser here in this office, a very advanced laser called DSLT, and that's an outstanding option. And then we have what we call Micro-Invasive Glaucoma Surgery, or MIGS. And if all of those fail, there's more invasive glaucoma surgeries that a person would find offered in a glaucoma-specific practice. The treatment algorithm for glaucoma has shifted over the last 10 years. Several studies have come out and shown that while in the past the initial treatment was almost exclusively with eye drops, we're now finding that the laser that can be done in the office, that's called SLT, and in our case DSLT, has a better impact the earlier in the course of the disease that it's applied. And therefore, most practices, and ours included, we are recommending at least consideration of the SLT laser as our first line. Drops, when we start drops, and we have a number of categories of drops, and many of those are quite effective, but they almost all have side effects, whether it's eye redness or changing the color of the iris, or sometimes having side effects regarding pigmentation around the eyelids or eyelash growth. There are a number of side effects. Some can have systemic side effects, including shortness of breath and decreased exercise tolerance. So while drops have been a mainstay over the years, more and more glaucoma is being considered for surgical intervention, including the laser as well as these micro-invasive glaucoma surgery devices. iDose is a recent entrant into the MIGS device field, and this is a very unique delivery device. Basically, it is taking a drug called travoprost, and instead of having the person put that in their eye every day for the rest of their life, we can deliver that drug in a tiny little titanium canister that anchors inside the wall of the eye, and then delivers that drug over a 3 to 4 year period. And recently it has been approved that if we see the effectiveness of this product wearing off, then we can go in and remove the old one and replace the new one. So part of the problem with glaucoma is remembering to use the drops. You know, somebody may have good intentions and they may find that they forget this eye drop 2 or 3 times a week. And by delivering the drug 24/7, 365 inside the eye, we eliminate that aspect of what we call compliance with care instructions. We don't generally offer a person a procedure for glaucoma that is not covered by their insurance. We want to avoid that. Every person that is 50 years old or older should at least have a baseline exam to make sure that they don't have the precursors of glaucoma or macular degeneration. And so for detecting these diseases, if a person has perfect vision and doesn't need a prescription, they may not even be seeing an eye doctor. And starting at 50 years of age, every single person should be screened for glaucoma and macular degeneration. Now, if a person has a family history of glaucoma or macular degeneration, they should actually be seen earlier so that we can detect it, or even the risk of it at the earliest possible opportunity. Glaucoma and macular degeneration are both diseases of aging, so the incidence of that goes up dramatically as we get into our later 60s and 70s, and so at that point it's probably worth being seen every year. One thing I think is an important consideration for any patient that has glaucoma and also has cataracts while we're inside the eye at the time of cataract surgery is a great opportunity for us to go ahead and intervene on behalf of that patient in terms of their glaucoma condition. And the devices that we have are very effective and very safe and very well established and accepted in medical practice. So anyone who has a diagnosis of glaucoma and is being treated either with drops or perhaps the laser in the past should consider and discuss with their doctor whether or not we can offer a MIGS procedure to lower their pressure.